Hi, my name is Lanisha Yelden, and today I'll be showing you how I set up dental for a dental procedure on a canine with simple extractions. So first, you've got your dental machine all set up. It's already all plugged in at the wall. You want to make sure that your brown bottle here, which is your CLS solution, and with your distilled water both filled up to the line prior to going ahead. You just want to make sure that obviously there's some pressure in the machine prior to taking those bottles off. It's already actually plugged on, so all the pressure's already in that. So you just want to make sure as well that you've got all of your buttons on, so your scaling machine as well as all of your compressors and stuff. Now I'll take you through each part of the dental machine. So you've got your stepping tool there, which is for your coffee paste. So you just put your oscillating coffee cup onto the tip there. And you just want to make sure that it's obviously got the pressure in there, so just making sure that's moving. And then you also just want to make sure with your air and water that it's got sufficient amount of water flow to it as well as air. And same for your drill. Now with your drill as well, you just want to make sure prior to using it that you have oiled it. So you just take off the top there, using your IM3 oil solution, you just put it into the base of that hole there. That's already been done, so I won't do that for you. I'll just pop it back on. Also too, with your ultrasonic scaling machine, you just want to make sure that it's got enough water flow. So just turn it on there and just make sure there's enough water coming out of there. The more the better, just so you don't heat up that tooth and heat up the pulp and obviously create a dead tooth. So once all of that is done, you just want to make sure that you've got everything that you require for your dental extraction. So including PPE, gloves, goggles and mask, and then also your dental instruments. So here I've got the periodontal probe, which is used to just measure the millimeters depth of that periodontal sac there. Now for dogs, it's to be 3 millimeters or less. And then also the Explorer on the other side there, which is just to check if the tooth is smooth just by moving it like that. And then because we are doing an extraction, we've also got both of these wingtip elevators, which is just to sever and move that periodontal ligament, which actually holds the tooth in place. And then last of all, you've got the extracting forceps to grasp that tooth and actually pull away from the bone there. And because we are doing an extraction, I have got the vet ready some instruments and suture material just to close that gum up. So just some rat tooth forceps and just some needle drivers with the cutting ability there, and some 3O Monoq suture material. Now in terms of maintenance and sharpening of these instruments, you've just got on the back here all of the maintenance required for this IM3 machine, as well as the instruments on the back there. Now in terms for sharpening, you do have this sharpening block. So the way to do that is you just hold it in your hand with your middle finger and your thumb, only sharpening the back of the instrument there, so you're not creating any sharp edges. So all you do is just find it there and then moving the one with your block. Same for the other side. And then I just like to wipe and just make sure you can feel any sharp edges, and the vet will let you know when they're doing the extraction if it needs to be sharpened again. Also too, I just have some Profi paste here, just basically just to put into the osculating cup like this, just to polish the tooth there. Now the reason that we polish is just to create a smooth surface on the tooth, so that way no more tartar or calculus can actually build up on that tooth. So now that everything is basically all set up, we're pretty much ready for our dental extraction. And just to make a note too, because we are doing a dental procedure, having adequate heating underneath a certain amount of towels, just because obviously it is a wet procedure, so the patient's more likely to get a bit more hypothermic. Thank you.